I was diagnosed with a highly vascular, aggressive, high-grade glioma brain tumor just over 10 years ago now. And leading up to that point, I thought I was supremely healthy. I was on a pescatarian diet, and I was studying for a master's in nutritional therapy at the time, which I was on to try and manage migraines, because before that I was working as a personal trainer and I kept getting migraines, and I thought, if this continues, I can't continue in my profession. And so I sought to try and find answers to why I was experiencing these migraines on this supposedly perfect diet that I was on. And I didn't drink, I didn't smoke, I didn't take drugs. So I was trying to find solutions, and at that time at the tail end of 2012, not 2012, on my course I was learning about the ketogenic diet and cancer, and I dismissed it as just being this ridiculous thing because it was high fat, and there was still this fear about saturated fat and cholesterol. And so I dismissed it. I didn't think it had any credence until a few months later, and we're getting into the start of 2013, after an intense training session in central London with a personal trainer, and the week before getting a personal best 5K time, which I was pretty pleased with at the time. Despite the horrible headaches I was experiencing, I was kind of just shrugging it off until I rushed to get on a train after my exercise session, and the train was pretty busy. I rushed to get to it, and this feeling in my head just consumed me. I had increasing pressure to the point where I was convinced that I was going to die on that train. It was pretty horrific, and I can't really describe just how that felt, feeling that you're about to die and making strange yelping noises, not being able to control your body. So eventually I suffered a brain hemorrhage, which was near fatal. I woke up in a kind of semi-conscious state on the other side of the train with a dislocated shoulder and various injuries. All I could hear was muffled noises, and I was rushed to the nearby hospital where I was having constant grand mal seizures. All I could taste was blood because I'd keep going in and out of consciousness, and my tongue had looked like it had gone through a blender. It's pretty horrific. And I had a whole group of doctors around me and nurses, and a couple of very interested medical students. So I thought, oh, this is interesting. And when I was trying to figure out what was going on, I just kept slipping out of consciousness. And eventually I had an intravenous infusion of levetiracetam, which is an anticonvulsant. And my seizures stabilized to the point where I could figure out where I was, but I didn't quite know what was happening. I was rushed into having a CT scan, and the doctors kept coming back to me and saying, we think you have an arteriovenous malformation, but we're not sure because the scan's just so bloody. They can't really see anything, so let's wait and see if it clears up, and then we can clear up what our idea of what you have is. So to cut a long story short, I eventually had an operation to remove this mysterious mass in my brain. I was told very confidently by a neurosurgeon that this was likely a cavernous hemangioma and not to worry about it because it's definitely not a brain tumor. Spoiler alert, it was a brain tumor. But we both only discovered that after the histology came back. And that was pretty scary because this was after the operation on a Friday evening after I'd just got home. I was still suffering pretty horrific seizures, which I couldn't understand because I thought, well, they've taken this out. Why am I doing this? And every time I'd feel like a seizure was coming, I was thinking, am I going to wake up from this? Because it's like, I wouldn't wish that on my worst enemy. It was pretty horrible. I'd lost my speech. Ability to move down my right side was compromised. And I was told over the phone, I'm sorry to tell you this, but we weren't aware of the histology reports come back, and I could tell you that what you have is a terminal type of brain cancer, and this was over the phone on a Friday evening. A terminal type of brain cancer, and I've booked you to come in on Tuesday for chemotherapy and radiotherapy. He said, I'm sorry to tell you it's terminal, but it's treatable but not curable. And I thought, well, what does that mean? I had a consultation on the Tuesday, very confused. Still having seizures, so I had to go in with my parents. And because I was having these horrific seizures, my mind went back to that lecture that I had before I was diagnosed in the nutritional therapy on ketogenic diets. And I knew that it had an established history for children with epilepsy for almost 100 years. And so I actually started to adopt that approach. And I mentioned this to my oncologist, who was saying, you need to have this chemo and radiation. And I thought, okay, what's the rationale behind this? What kind of impact on survival am I going to have? And he said, well, for you, it's possibly not great because your tumor is IDH. You have these different mutations that confer different survival outcomes and response to treatment. So mine was an IDH-wild type high-grade glioma. It was termed as an anaplastic astrocytoma at the time. The guidelines have recently changed such that the molecular characteristics of my tumor would be more similar to a glioblastoma, but it's different subcategories. Brain tumors are quite ambiguous. It's difficult to properly characterize. It's based on a number of different factors, both in the imaging and histologically. So, I was transitioning onto a ketogenic diet to treat my epilepsy. I was very skeptical of any of the anti-cancer benefits because I'd learned about Harry Eagle's work on glutamine. I knew glutamine was a major fuel for different types of brain cancer in particular, and different amino acids. So I kind of dismissed it, but I thought, well, these seizures I can't really live with, and I'm not even able to get out of the house because I can't go out alone because I'll have a seizure and I go unconscious. It's pretty horrible. So I thought the ketogenic diet would help me. I quickly went on a 4-to-1 ketogenic diet, which I knew was prescribed for drug-resistant epilepsy. And I was working with a charity called Matthew's Friends, who had just started seeing brain tumor patients, not necessarily to treat the brain tumors, but you get an avenue where you can get into that kind of area with the epilepsy. So the epilepsy was kind of a blessing for me. And in fact, if you have any kind of brain tumor, if you're having constant seizures, that's actually kind of a good thing, because not only are you able to have this constant feedback on what's potentially helping and what's not in terms of just your brain in general, brain health, but also that if you're having seizures, that means that your neurons are still acting in the way that they wouldn't if you had a more really aggressive type of brain tumor where you have necrosis. So if you have tissue necrosis, you have less activity between those neurons. So if you're having more seizures, if it doesn't kill you, that's actually a good thing. But in my case, every time I had a seizure, it caused quite significant brain damage, so it's not great. And so, yeah, I adopted a ketogenic diet, and I started learning about brain tumors, and I went on to the standard of care for a short period of time until I realized through my research that for me, my tumor was treatment resistant, and I still had some signaling activity on scans, and the treatment was causing my seizures to be more severe. So I had a discussion with my oncologist, and I said, for my kind of tumor, I've been reading about the STUP protocol, which is the protocol for high-grade glioma that was established almost 20 years ago, but we still use it, and survival outcomes haven't changed. And I mentioned how an unmethylated MGMT tumor, which is what mine was, has a median survival with the standard of care. The survival benefit is 4 weeks. And I said, how is this? You said that this is a significant survival. How is that significant, and what's the quality of life like? And why should I continue with this? And the long and the short of it is that the recommendation to continue was because they wanted more data to try and see if that was in fact the case with hundreds of patients rather than just a small subset. And so I wasn't convinced that it was a good idea for me to continue, so I abandoned the treatment, and I still had this signaling activity on the scans. Signaling activity doesn't necessarily mean that that's residual disease. I was told by the neurosurgeon that because I was misdiagnosed, he didn't think that leaving disease in the motor strip area, which couldn't be operated on, was an issue, because he didn't think it was brain cancer. And otherwise I would have had an awake operation. So I'm actually thankful I didn't, because maybe I could have had worse disabilities. But anyway, I went off the treatment. I was still having seizures on 4-to-1 ketogenic diet. So I questioned myself, and I looked at the literature more, because I didn't want to stop doing it. I wanted to try and have a solution to my seizures. And I also wanted to have some insight onto what I could do to help with the brain cancer. So I investigated my anti-epileptic drugs, and I was on the maximum dose of levetiracetam. So I thought, okay, I can't play with that too much. What can I do which in turn could also help me? And my research brought me to a drug that's not often prescribed for brain cancer-related epilepsy, which is sodium valproate. And I learned that this is a repurposed drug that could be complementary to a ketogenic diet. And what sodium valproate is it's valproic acid, which is short-chain fatty acid. We had a talk with Dr. Bickman about how these short-chain fatty acids are active. They can have a response, and there's this gut-brain connection. And so I decided to go on sodium valproate, put myself on it. I convinced my he was the neurosurgeon at the time who I was seeing about this. The neurologist didn't really want to discuss a lot of the things I wanted to discuss at the time, but okay. So I put myself on that, and I started researching ketogenic diets for epilepsy. I learned about oligoentogenic ketogenic diets, which I hadn't heard of before. It was this big name. And from that, I learned about why the ketogenic diet that I was on wasn't working for me. It's because I had this almost allergic response to certain foods that were traditionally ketogenic, and they ended up being mostly plant foods. So I stumbled upon being on a carnivorous ketogenic diet similar to the PKD, actually. I didn't know anything about this at the time. And my seizures completely resolved. And then over the course of 2 years, without any support, I learned about how to wean off these medications because I was on so much anti-epileptic drugs that it was affecting my quality of life. And so over 2 years, I managed to get completely off my anti-epileptic drugs. And over the course of that time, the signaling activity was dissipating on my scans. And because I had quite a lot of fatigue and brain damage, I decided to have hyperbaric oxygen therapy, and I had that for 6.5 weeks. And towards the end, I started to get my energy back. And my scans were looking even better in terms of the scar tissue that I had, which I didn't think was even possible. And so, I had a real benefit from that. And I had my story in New Scientist magazine in 2016, I think it was. I went back to studying cancer biology and did various courses after that to try and understand what was helping me and how I could help others. And so now, as Sam mentioned, I'm doing a brain tumor study myself. It's a self-funded study. So I found a lot of difficulty funding this kind of work. I've been trying to since 2015, so I thought, I'll have to do it myself. So I'm working with a great PhD candidate who's a good friend of mine, Isabella Cooper. And we're trying to establish a metabolic phenotype of glioblastoma and identify how we can target that. So, that's my story. The other aspect of that, which is kind of controversial, is that at one point I was experiencing issues with the contrast agent. And so I decided to not have contrast after that because it was aggravating my symptoms. And it's only been recently discovered that the contrast can be retained in certain regions of the brain that are involved in fine motor control, and potentially have an impact on immunity and the cancer itself. So not advising anyone to not have it because it does have its uses in most circumstances. But I don't have any contrast on my scans now, but that's another point. But overall, I only eat 1 to 2 meals a day, and I do very well fasting with my epilepsy and ketogenic diet. I don't have seizures anymore. I haven't had a grand mal seizure in about 8 years, just 8 or 9 years. And thanks. Cancer patients often experience gut dysbiosis. One of the issues that we have with the ketogenic diet at the moment is that people are, for some reason, it's become a thing, afraid of animal fats. So they're adopting these plant-based ketogenic diets. That's causing a lot of issues where people are saying, I'm trying a keto diet and it's not working for me. I'm not going to have these animal foods because it's not going to be good for me. You know how much
how beneficial animal-derived fats are for the brain, causing a lot of issues because the fatty acid profile of the diet is probably the most important thing. Avoiding these seed oils, making sure the omega-3 and 6 ratio is optimal. One of the most important fats for the brain for controlling epilepsy and also with brain cancer is docosahexaenoic acid, so the omega-3 fatty acid that's predominantly composed in the brain. That's the most important thing to focus on with these diets. And if you're having a plant-based form of that, it's devoid of that. Not going to help. I don't have to weigh my food anymore. My tolerance has improved massively. Most of my meals are carnivorous meals. A lamb heart. I eat lots of lamb hearts because they're cheap, and I know it's grass-fed as well, and it's from usually a local farm. Eggs, you have a lot of eggs, making sure they have the nice orange yolk, a good source, because I think that's really important. I focus mainly on the egg yolks, so I don't tend to eat much egg whites. I can tolerate things I couldn't before, like avocados, which I couldn't have before. I'd have a horrible reaction to them. It'd give me migraines. I avoid most cheeses, but I can have goat's cheese. If I have any other cheeses, it gives me horrible migraines, especially aged cheeses. I think that's due to the tyramine. That's a known migraine trigger, so I avoid that. I do a lot of fasting now just because it's convenient and I'm more productive, have more energy. I can get addicted to that, so I don't do it as often as I used to. And I don't do extended fasts like I used to. I do a lot of walking as well. That's crucial to mention, actually, because I noticed there's a therapeutic zone of my blood glucose and blood ketones that I need to stick within for my brain to feel normal. Otherwise, if I slip out of that zone, I began to experience this low-level seizure activity, which reminds me that, I need to not relax too much. And the walking helps that tremendously. So I average at least 20,000 steps a day without even thinking about it. The most important aspect of that is my morning walk. So as soon as the sun comes up, at the moment, takes a while, so I start to walk in darkness, but it eventually comes up. I expose myself to the morning light and I go for a walk, and if I don't do that walk, then my seizure threshold isn't as high and I experience this low-level seizure activity. So staying in bed is not good. Lots of walking, mainly carnivorous diet. I eat 2 meals a day every day. Sometimes I eat 1 meal a day, but then that makes things difficult because then I have to eat more on other days to keep my weight up. I lose weight very rapidly. But I've managed to know how to put weight on now, which is nice. And I've done some experimenting with resistance training. That's the next test on myself, to do more resistance training, because glycolytic exercise can be a seizure trigger for me. So I need to manage my breathing. The breathing's a huge thing there. Interestingly, with epilepsy, you can actually, if you're having an aura or about to have a seizure, you can administer carbon dioxide. Like an oxygen tank, you have carbogen, and that can reverse a seizure. If I'm in a stuffy room with poor ventilation, I feel like I'm more likely to have a seizure, which is true. But then I was surprised that carbon dioxide seems to help. And if I have carbonated water, it seems to help raise my seizure threshold as well. I'm not sure why that's, but maybe it's something to do with that. Well, there's this thing called the breath exchange method. Amazing woman I interviewed on my podcast called Gemma Herbertson. Technique that she adopted, whereby her son who had uncontrollable seizures, she would breathe through his nose when he was having a seizure, just kind of like rescue breaths, and it would stop his seizures. And that's the same kind of idea. It's the carbon dioxide.